Hello, I'm Dr. Soto here at Endodontics Associates. I get a lot of questions about root canal treatments, and I'm here to help and answer those questions with you. What is a root canal treatment? Well, a root canal treatment is when we go inside the tooth, the inside of the tooth is hollow, where we call it nerve, but it's an ecosystem of little capillaries, nerve, lymphatic tissue that we call a pulp. And it's when this pulp is diseased, it's not working anymore. Either you're having a dying pain of cold or hot, or that tooth, you cannot bite on it. All those symptoms that we diagnose that the nerve is in stress and we need to just say goodbye to it. So we work inside that tooth and we just do a little hole on the top of the tooth or the side, depending on the tooth, and we'll just remove that little tissue out. Just clean it all out, get rid of all that bacteria in there, and then we'll fill it with a filling and a glue or sealant, and then we'll just put a filling on top of that little hole or axis, and we'll refer you back to your general dentist for them to put a crown as they determine. If you already have a crown, don't worry about it. Most crowns can be safe by putting a permanent filling attaches to your existing crown. So very, very simple. Sounds very simple to say. A lot of patients are scared to death about root canals, but we have been doing this for many, many years. We're experts. We have a lot of tricks and techniques to get you to save your tooth and keep it in there functioning for a long time. When is it too late for a root canal? Well, too late for a root canal is when the tooth is fractured. Unfortunately, we cannot glue pieces back. In some instances, for example, if we're talking about a molar, molars have more than one root. Well, if there's a root that is fractured and we're able to remove that root and keep you with the other one standing, with you functioning properly where you can chew and eat and bite, then we will do that. But unfortunately, if it's a front tooth where it only has one root and the root is fractured, that tooth, we're just going to have to say goodbye to it and replace it with something better, either an implant, partial, or a bridge. That's when we discuss with your general dentist on what will be the best course of action to bring you back to functionality so you can chew, smile, and enjoy the rest of your time with new teeth. What happens during a root canal? Well, when you're set up for treatment that we have discussed about your symptoms, we got exactly the proper tooth number, exactly a plan or game plan on how we're going to keep this tooth for many, many years to go. Then you come to that appointment. That appointment usually is about an hour to an hour and 45 minutes, depending on what your needs are. Sometimes we can do the full treatment in one appointment. Sometimes we need several appointments to get to the end of the root canal. Some teeth need a little bit more time. On top of that, we don't want you to be with your mouth open more than an hour. Honestly, it's too much stress for your jaw, and we really have to consider that too. So for that appointment, come comfortable. We always tell patients, just come comfortable. We have pillows, some glasses, blankets to make you comfortable. We have some music on the background, and we're going to numb you very, very well. Numbing takes a little bit. Okay, it's like a good steak that needs to be marinated for a while to taste really good. That's exactly what we do. We numb you very well, and we just don't jump into treatment. We need to let that soak in there, absorb, so you're very, very numb. And we test the numbing before we start drilling on a tooth, right? So most of the fears are that patients think, man, I am in pain, and now I'm going to feel more pain. Well, no. We're not here to inflict more pain. We're here to remove the pain. And then once you're very numb, then we isolate the tooth. We put a rubber dam. If you don't know what a rubber dam is, it's like a plastic material or plastic sheet that goes over your tooth because we're working on just that tooth. And we're going to rinse it with a couple of rinses. Some smell better than others. One of them is like chlorinated water. It's just to kind of disinfect that tooth and get rid of the bacteria. We also use the GentleWave, which is a procedure that helps remove all the nerve tissue, all the bacteria out from the inside of the tooth. And that's like a pressure washer with a vacuum. We elect that that's the best for your tooth. That's what we're going to do. If not, we're going to grab our laser machine and just zap those bacteria out of there. It's all about killing bacteria, and that's what we need. Once the procedure is done, we clean it very well. We dry the inside of the tooth, put a filling with a little glue in there, and then we'll just cork it or just put a filling on top of the access hole that we created. And then we'll give you the instructions and give you a hug and just say, okay, hopefully you don't need our services anymore. But if you do, we're here to help you, and then we'll just refer you back to your general dentist. Our responsibility after you leave our office is that we will send an email or a letter to your doctor explaining everything that has been done and what will be the next step for them to complete. What type of anesthesia will be used during a root canal procedure? We have between 5 to 6 different kinds of anesthesia. That is very individualized. Some patients cannot take epinephrine that is mixed with most of the dental anesthesia. So that is something very important that will be discussed before any treatment, either during your consult or during your consult treatment. We will go over those and then we'll choose the best one for your case. Root canals versus dental implants. They both are very important. Why? Because the end result is to keep your functionality, is to keep you chewing, smiling, and functioning with your teeth. Healthy teeth and gums extend your life. So that's what we're here for. Now, as an endodontist, we want to save your tooth. I believe that there's nothing better than your own tooth. So if there's options for you to keep your tooth, that's where an endodontics is here for, right? That we're going to recommend a root canal. But if we evaluate and we say, listen, this tooth really doesn't have much options. It's a fracture. You have lost pretty much all the bone around surrounding or supporting that tooth. We're going to recommend an implant. Not that we hate implants. We just absolutely don't. But the fact is that there's nothing better than your own tooth with your own cells, with your own ligament. You know that tooth. You came to this world with that tooth. So the fact is that let's see if we can keep it for a long time. Always use this analogy, and patients that know me, that have come through our practice, know that we're always comparing, right? Because it really is very difficult to explain something that is inside your mouth that you really can't see, and then on top of that, inside your own tooth, right? So I'll always kind of compare with something else that you can see. For example, if a tooth is infected, right? So the pulp is infected, and how am I explaining that you need this treatment? A lot of times patients say, well, what about if I just pull it and put an implant? Well, this is the analogy I use. I said, well, what if you have an ingrown toenail, right? Think about it. The ingrown toenail is infected. Your toe is infected. Will you cut your toe off? Absolutely not. That is just totally unheard of, right? You just remove the little piece of nail that is your nail, remove it out of the area, let the tooth clean, probably take some antibiotics, let's get back to health, that infection is gone, and you keep your tooth, right? So the same thing. If we can keep your tooth in there by cleaning that nerve out or pulp tissue out, giving you some antibiotics, getting rid of the bacteria, why not keep your tooth? If we are not unable to do that, definitely we will recommend the next best thing will be an implant or a 3-unit bridge. Why are dental crowns recommended after a root canal? Very simple. The access hole that we create inside your tooth is quite significant in some cases because we are looking to make sure that we remove all the nerves inside your tooth. So with that said, especially on the molars, that they are the grinders, they are the clenchers, they are the ones that are chewing your food properly, that you can chew on nuts and cashews and good steak and corn nuts and popcorn. And of course, those are things that we really try to limit, right? But if you're going to do it, you're going to do it. So those teeth need to be protected with a crown. And a crown is like a hat. It's just holding all the pieces together. So that way, when you're doing this motion or side motion, that tooth doesn't break or fracture inside your mouth. How much does a root canal treatment cost? Well, it depends on the tooth and the location of that tooth inside your mouth. It can range from $800 to $1,800. It all depends on the different things that your tooth needs. Some teeth need a combination of a root canal treatment with surgery. Some teeth just need the root canal. Some teeth just go into a surgery approach. So all those things will be discussed when we do a consultation with you. And then we get into an agreement on what will be the best course of action for your tooth. I hope that I was able to answer all your questions or at least give you some insight or clarification on what a root canal is and what we do. We're here to help. So if you have any more questions, please feel free to call us at 770-499-2102 or shoot us an email or a text. We are here to help you. We're here to just instruct you and just to make more friends. So I hope that I clarified, and I hope you have a blessed day.